Hey everyone, today we're going to finish up our conversation on the respiratory system by talking about respiratory disorders. And I guess I want to begin with one that you're probably pretty familiar with, asthma. So asthma is kind of an interesting disorder in that probably many of you have some experience with asthma. Maybe you have a family member, maybe you yourself suffer from asthma, so you're kind of familiar with it. But what's interesting is that while everybody is sort of familiar with it, people don't generally recognize exactly what it is. Asthma is interesting because it can either be inherent or it can be triggered. That is to say, it can either just be something about your makeup that causes you to have an asthma condition, or it could be triggered by some exposure. So we can have what's called allergic asthma or non-allergic asthma. And asthma itself can be triggered by everything from, say, pollen to you can have exercise-induced asthma that will be triggered by the increased need for oxygen with exercise. You can have occupational asthma, which is asthma that, of course, is caused by some kind of environmental trigger in your place of work. Asthma is frequently exacerbated by things like air pollution. So we know that children that live near highways and major transportation hubs tend to have more asthma. What I find interesting about it is that frequently people will imagine that these pollutants cause their asthma. And that's not quite right, but in some ways it's exactly spot on. What I mean by that is they had a condition of asthma that made them sensitive to something like, let's say, car exhaust or pollen or some other kind of trigger. So it's not the case that the pollutant or the pollen caused the asthma, but rather that the pollutant or pollen triggered the asthma. Having said that, if that child that lives near the highway instead lived in a rural farm area, they might live their entire lives and never have an asthmatic attack, and therefore, by virtue of never having had any symptoms, not have asthma, even though they would have had the same physiological vulnerability to asthma because they were never exposed to the trigger. They never actually had asthma. So, short version of this is asthma is not caused by pollutants. Asthma's attacks or asthma symptoms are triggered by pollutants. Nevertheless, if you never exposed to those pollutants, then you would basically live your life without asthma. Reasonable question at this point, what is asthma? So it's an inflammation of the airway that basically causes at least two dynamics. One is that your airway is going to be inflamed. And here's an image for you. That inflammation is going to be, make it more fluid in the tissue of your airway, and that means that your airway's opening is going to be smaller, and that's going to make it somewhat harder to breathe. In addition to that, you're going to have more mucus formation, excess mucus formation, so that also is going to make it harder to breathe. And basically, you're going to be breathing in and out, and you've probably experienced somebody who's having an asthma attack with a constricted and mucus-filled airway that's going to sound a little bit like and it's just going to feel like you can't possibly fill your lungs. You can't breathe in enough to get that air into your lungs. The problem is not strictly with your lungs, it's with your airway. But if you can't get air through the airway into your lungs, it's going to feel a lot like a tight-chested kind of airway constriction. Okay, so all kinds of dynamics to this. It's a pretty common kind of problem. One interesting dynamic, or one interesting theory, I should say, that's out there is there are some folks that are looking into the possibility that asthma is actually triggered by infant virus exposures. So it's possible that it's not just the case that you're born with a proclivity toward asthma, but that as an infant you're exposed to certain viruses, and those viruses therefore trigger an asthma or the possibility of an asthmatic response. The typical treatment for asthma is a metered dose inhaler. That is to say, some kind of drug that is a bronchodilator and will be delivered directly to your airway. Those inhalers look a little bit like this, and you just pop off the top there and you exhale aggressively, and then you inhale in, and as you do, you squeeze down on the top part here, and it blows a little bit of something like albuterol into your airway. And ideally, if you breathe that in deep and kind of hold it there for a second, that albuterol gets fully into your airway and it causes a dilation. It causes an opening up of the airways. One of the drugs that would do that, by the way, is epinephrine. Another word for epinephrine, you've heard before, is adrenaline. And now you can start making sense of all the things we're talking about, because it should make total sense to you that adrenaline would have this effect. Because adrenaline is one of the dynamics of a sympathetic response. And a sympathetic response, that's the fight or flight kind of dynamic, is going to get you ready to fight off that saber-toothed tiger or run like hell from it. And either way, you're going to need open airways to do that. So evolution has caused a epinephrine or adrenaline boost to open up your airways and therefore get you ready to run away from that saber-toothed tiger. In this case, you have an asthmatic response, but the adrenaline will have the same effect. It'll open up those airways for you, right? So that should make some sense to you. Another similar kind of dynamic is bronchitis. And from the title, you can figure out what bronchitis is. Itis means inflammation, inflammation of the bronchial passageways. So when those get inflamed, you've got a bronchitis. Acute bronchitis is one form of bronchitis. The other, you might guess, is chronic. Acute bronchitis itself basically just means that those bronchial passageways get inflamed, going to have some mucus in there. So when you have this, which could be the result of, a virus infection, for example, it's probably going to go on away on its own. Your defensive systems, your immune system are going to fight this virus and in the end probably win and beat that back. So that inflammation is going to go away. But you've experienced some bronchitis, some coughing, phlegm coming up, etc. That's basically acute bronchitis. Another possibility is chronic bronchitis. We have long-term exposure to inflammation of your bronchial passageways. And the effect of that is quite different in that over the long term, that inflammation is going to deteriorate or destroy your cilia. Remember what those are? Those are those hair-like fibers, that microscopic shag carpet. And the goal of that is to work with your mucous membranes to move contaminants out of your airway. But if you have long-term chronic bronchitis, those hair-like fibers on the walls of cells are going to deteriorate. They're going to be destroyed. They're going to be damaged. They're not going to be able to do their job. And that means all that debris, all those contaminants, all those possible pathogens that are going to make their way into the airway are not going to be adequately removed. In addition to that, it means mucus production is going to build up there because the actions of the cilia also continue the current of mucus flowing through your airway. So now you got mucus that's kind of settled in, getting thick, and this is the kind of bronchitis where you cough up regularly because you're doing the job your cilia is not doing. You're taking these contaminants and you're trying to get them out of your body, right? So you're coughing up thick, discolored, maybe yellow, green, gray mucus, which is the diseased mucus of dysfunctional tissue in your airway that basically cannot do their regular job, which is removing debris and possible invaders from your airway. What is the cause of this horrible thing? Well, you probably guessed it. One of the principal causes is smoking. Yeah, it turns out that taking toxic smoke and intentionally inhaling it into your airway day after day, year after year, is not a good idea. We're all shocked by this. By the way, before you blame your parents for being stupid enough to smoke, also realize that smoking things other than tobacco and even vaping creates many of the same effects. So bronchitis can be caused by smoking or basically exposing your airway to dangerous toxins. Asthma can potentially complicate and cause bronchitis. GERDs, that is to say, acid reflux, can sometimes cause it in changing the pH. Basically, acid reflux means you get more acidic content in your esophagus. That can not only damage your esophagus, but it can raise the pH of your airway, and that can create the same kind of damage to your bronchial tissue. So that can be a problem. It can be an autoimmune disorder. We've talked a lot about autoimmune disorders, so this should be no shock to you that I'm pointing out that, yep, this too could be the result of an autoimmune disorder. And more notably, it can be the result of air pollutants. And that can be a pollutant at work. It can be a chemical pollutant. It could be smoke. So if you work or live in a condition where you're exposed to I don't know, exhaust or smoke or other kinds of things like that, particulates, those can definitely stress and damage that tissue, destroy the function of your cilia, and cause you to have chronic bronchitis. And that is a definite life-changing / life-threatening issue. Sometimes related to bronchitis is another disease which is distinct called emphysema. So far we're talking about the bronchioles. Emphysema is actually a disease of the deeper tissue in your lungs, your alveoli. So in this case, what's happening with emphysema is that those air sacs, those alveolar air sacs, are starting to lose function. Basically, the walls start to degrade as a result typically of exposure to toxins. So you can guess where I'm going with this. Yep, it's related to smoking. The alveoli tissue itself loses elasticity. And what happens is instead of having all those alveoli, all those tiny little microscopic cells that expand and contract and allow for gas exchange, the walls between them break down. And so you can see in this image, you don't have distinct alveoli. You've got like one big open kind of cluster-shaped alveolus. Now, the reason that's a problem, you should know by now, right? Because I made a big deal in a previous video about how important it was to have a large surface area to the lungs. That's what allows for the gas exchange. So I pointed out that your lungs have about the surface area of a tennis court. Well, once you get emphysema, that surface area goes way down because the 20 or 30 different alveolar clusters now turn into just a few much larger openings, and the surface area goes way down. And as the surface area goes way down, the lungs are not able to do the things that they have evolved to do. You don't have enough surface area. Instead of having a full tennis court, you've got like a quarter or half a tennis court, and that's not adequate. In addition to that, because the tissue loses elasticity, it can't respond to respiration in the way it did before. It can't really allow for that full gas exchange. So you have trouble getting fresh air in and out of your lungs, have trouble allowing for gas exchange within your lungs. Here's an image of some damaged lung tissue. And you can see there the upper lobes especially have some pretty significant damage to them. And that is the damage as a result of emphysema. So, what causes emphysema? Already talked about smoking for sure, air pollutants, etc. Could be genetic and inherited factors as well. So certain people have a greater propensity for emphysema as a result of genetic predispositions. Respiratory infections can certainly lead to emphysema. Anything that can damage lung tissue can potentially damage your alveolar function and alveolar tissue, right? Then there's the possibility that you might be aware of, because you might have seen some TV commercials for this, of combining some of these facts together. And this is called COPD, chronic obstructive pulmonary disease. Pulmonary means lungs. We know what disease means. Obstructive means it is blocking the capacity of the lungs to exchange air. And basically, COPD is a combination of bronchitis and emphysema, and frequently also asthma in there, because as these things combine together, they sort of feed on each other and create multiple complications. So COPD is a really problematic disease here, where you've got basically alveoli that are not functioning properly. You've got lost elasticity in your lung tissue. You've got an inability to ventilate properly because your airways are constricted and filled with thick green, yellow mucus. You can imagine that this is not something you want to experience, right? One of the ways we treat this is with what are called CPAP machines. CPAP stands for continuous positive airway pressure. Basically, this is a mask that goes over your mouth and nose, or sometimes this is also used for snoring, for sleep apnea, where can just go over your nose. But in this case, for COPD, it's going to go over your mouth and nose. And this is going to create a pressure. Now, if you thought about this for a minute, I think you'd understand why a positive pressure, that's what it stands for, positive pressure, why a positive pressure might be a good idea. Because as you exhale, those alveoli close up, right? They're elastic, so they open and they close. The problem is if you've got chronic bronchitis and emphysema, is you can't open them up again. You can't create enough inspiratory pressure, excuse me, enough intake of air to open those alveoli back up. And the result is that you don't get good gas exchange. So the idea of a CPAP is to provide a little bit of positive pressure to keep those alveoli from closing up fully, to keep your airway open so that you can continue to have ventilation, and as a result of that can have good respiration or gas exchange. You can see why this would happen for sleep apnea too, right? If you've got sleep apnea, your airway closes up every time you fully exhale. And now you got to inhale and open it all the way up. But you've got sleep apnea, so you aren't inhaling effectively. A CPAP allows you to keep that airway open with a little bit of positive pressure so your airway never fully closes. The dilemma with CPAP might be obvious to you now as I describe this, which is when you're exhaling, when you're breathing out, you've got to push against that positive pressure. So for folks where CPAP doesn't quite work, for folks that are so sensitive where they have trouble also breathing out against that positive pressure, there are BiPAP machines. And a BiPAP machine still provides positive pressure like a CPAP, but the positive pressure changes and is rated with the breathing. So as you exhale, the positive pressure goes down. Still some positive pressure to keep your airways open, but it goes down to allow less resistance against your exhaling. And then the positive pressure comes in when you inhale to open those alveoli. It's not quite like an oxygen mask. It's not providing like 100% oxygen or a strong pressure. It's just enough pressure to keep your airway open and to keep those alveoli from collapsing and closing up, because you don't have quite the respiratory capacity to open them back up again. So that's the idea of a CPAP or a BiPAP machine. You might at this point reasonably ask, why do we even have CPAP? BiPAP sounds a lot better, because BiPAP is a lot more complicated and a lot more expensive. And for all the people out there that might have this issue or sleep apnea and could benefit from CPAP machine, it's much more effective to provide them with a relatively less costly and simpler to operate CPAP machine than to provide them all with a much more expensive and much more complex BiPAP machine. So we basically only use the BiPAP machine when the CPAP machine isn't doing what it needs to do. Okay, other kinds of respiratory issues you might have heard of. Well, here's one, TB, tuberculosis. You've probably heard of tuberculosis, right? A very serious illness. It's a bacterial infection, actually, of the airways. So in this case, you've got a bacteria, it goes into the airways, it starts creating damage and inflammation and an inflammatory response, which compromises your capacity for respiration, etc. The dilemma with this is that it's in your airway. So what happens? Well, you do things like cough. And when you cough, that bacteria gets spread all over the room. So the challenge with TB is not only that it's deadly, but it spreads really aggressively by virtue of being an airway infection. Tiny droplets with bacteria in them fly throughout the room whenever you cough. And given that this is an inflammation of your airway, you're likely to cough. So now you're spreading these bacteria around the room. So anybody that's in that room is going to be exposed to that because they're going to breathe in some of those tiny droplets that are floating around in the air now. In particular, people with, say, HIV/AIDS or people that are immunocompromised or on a immunocompromising drug are going to be particularly susceptible to TB. So we are very concerned about TB as a public health issue and tend to protect ourselves against it fairly aggressively. It spreads across the body pretty aggressively. So yes, it starts in the respiratory system, but it can impact multiple organs after that. It is, after all, a bacteria. It will move and spread and grow with as much capacity as you allow it to have. So TB is deadly and very, very prone towards spreading. As a result, it's a significant public health issue. So if you're going to be a nurse or doctor or something like that, you're going to learn about how to identify and deal with tuberculosis. Okay, Another interesting one that is a little bit of a cheat is cystic fibrosis. Cystic fibrosis is a genetic disease, and what it does is it causes sticky, thick mucus to build up. Now, why is it a little bit of a cheat? Because notice I said sticky, thick mucus to build up. I didn't say on your lungs or in your airway. In fact, cystic fibrosis occurs in many organs, but it's considered generally by the general public as an airway issue because that's where it manifests most notably in folks, because when you have sticky, thick mucus in your airway, you tend to be symptomatic pretty aggressively, right? However, what you should note is that that sticky, thick mucus happens in all other kinds of places, including, for example, your pancreas. We haven't talked about the pancreas yet, but the pancreas is going to be inundated with basically cyst and scarring as a result of this fibrosis, this sticky, thick mucus buildup. This is why it's called cystic fibrosis, because your pancreas gets cyst in it, and those cysts get scarring, and that scarring, you might recall, can also be called fibrosis. So it turns out, you're going to be shocked to learn, that having your major organs overtaken by cyst and scarring is not a good thing. So cystic fibrosis is definitely life-threatening as a result of it destroying your pancreas. It's going to destroy your ability to adequately digest food. That is to say, your pancreas, we haven't talked about this, but we will later, but your pancreas provides digestive enzymes. So if it can't produce those digestive enzymes, your ability to absorb nutrients is going to be compromised. As a result of that, you're going to start getting sick, you're going to get anemic. It's also going to affect your liver, it's going to affect your sinuses, your intestines. Cystic fibrosis, not a good thing. But we tend to think of it as a lung or airway issue because it is associated with mucus and tissue destruction that tends to manifest symptoms in your airway most earliest. Okay. The other thing you probably think about when you think about airway or respiratory diseases is lung cancer, because it is so common, and indeed lung cancer is a major, major, major threat. Smoking is the major cause of lung cancer. There are other forms, but to be clear, in men, about 90% of the cases of lung cancer are in smokers. And in women, I think it's about 75%, so a little bit less. And men are a little more prone to lung cancer as well. We talked about cancer before, so you should remember a little bit of this. What is cancer? It is abnormal and rapid growth of dysfunctional cells, right? So in this case, this is a mass of dysfunctional, diseased cells that are rapidly reproducing in your lungs. Smoking can clearly trigger that. Smoking has toxins in it that damage the DNA in your cells, that cause your cells to go crazy and start producing dysfunctional cells at a very rapid rate. Here's an example of lung cancer in somebody who's a smoker, and what you've got there is in that one lung, it's healthy, but you can see the other lung by comparison has a large mass in it, and then around that mass is a bunch of diseased tissue. That is, of course, the tissue that's been exposed repeatedly to the toxins in smoking. That's not the only cause of lung cancer, however. There's also exposure to things like radon that can also cause dysfunctional DNA. Asbestos, which is basically just like a really aggressive, complex particle that embeds into your lung tissue and then causes aggressive scarring around it, basically your inflammatory response, which can then trigger the development of irregular cells that rapidly reproduce. In other words, it's going to grow a tumor around that area damaged by the asbestos particles that embed into your lungs. So this can be really dramatic, and also, interestingly, is not necessarily limited to people who had direct exposure to asbestos. So we tend to think of these as folks that are like, we're mining asbestos or working with asbestos in insulation, but it could be a secondary or even a tertiary effect. You can have, for example, wives of men that worked with asbestos that actually come down with lung cancer as the result of being exposed to their laundry, being exposed to the modest amount of asbestos that was on their clothes when they did their laundry. Or folks that lived in a town that mined asbestos, and some of the asbestos got into, say, the soil or other kinds of conditions. So the asbestos itself can be pretty significant, and it doesn't take a very large exposure to potentially create a tumorous mass. Now, as we talked about before with cancer, it's really not the cancer that kills you. It is, but it's really not directly the cancer that kills you. What have you got here? You've got a mass, a tumorous mass that's rapidly reproducing in your lungs. That's going to interfere with your ventilation. That's going to interfere with your gas exchange. That's going to interfere with blood flow. That's going to interfere with all functions of your lungs. And it's going to perhaps penetrate into the pleura, which is going to then interfere with your lungs' relative motion with the thoracic cavity. It's going to perhaps penetrate into other organs, and all that's going to create, as you can imagine, dysfunction. So the mass itself isn't toxic. That's not what's going to kill you. What's going to kill you is the effect of that mass growing into all the surrounding tissue. So that's a little bit on lung cancer. Those are basically some of the respiratory diseases and dysfunctions I want you to be aware of. I'll see you on the next video.